Hey everyone, I'm Benj. This is What Could Be Bad. Thanks for tuning in. Today it's a special episode. We have a live podcast recording happening at Walking Mountains. We are out in the Vail Valley, and this is a podcast presented this time as a special episode because Vail Symposium has brought us together. And the guest that I am so honored and excited to talk with today is Dr. Paige Baker-Braxton. Welcome.
Thank you so much. I'm thrilled to be here.
Awesome. I'm really glad you are. Vail Health Behavioral Health is doing incredible work here in the Valley, and I know how entrenched you are in so many aspects of that. And to have you take some time out of your schedule to chat with me and to engage, in conversation about the things that are happening for you in relation to that, it means a lot. So really, thank you.
Well, of course, I think most people in the room know if you give me a microphone, I'll show up. So I'm just happy to be here.
Well, good. I'm glad it's on, it's working, and it's happening.
Ready to go.
Wonderful. Well, so I like to create an arc with the podcast and tell a little bit of a story. So I'd love if you could share how you came about through your educational process and sort of what brought you to this place in your career as much as this place in our country.
Yeah. When I was a little girl, I always wanted to be in the helping profession, and I thought it would be through medicine. I went to medical camp in high school. I was pre-med at Georgetown. I became an EMT. I took the MCAT. Struggled my way through organic chemistry, applied to medical school, got rejected from medical school, and then was at this decision point in my career. Do I study harder? Do I take more classes? Or do I really reflect on my strengths and what I want to do?
Sure.
And I was speaking to Dana earlier tonight. I had a therapist in high school that I think saved my life.
Oh, wow.
And so when I think about that and then think about what I'm good at, it really turned into psychology. I think about my time as a student athlete.
Uh-huh.
I played volleyball, I played basketball. I was never MVP. I think my season high score in basketball was like 6 points. So I wasn't taking home any state titles, but my best friend Erin, her dad used to call me Paige Baker Playmaker. And that is because I had double-digit assists every game.
Hey, every team needs someone to help get those,
right?
balls in the hoop. That's right.
And that's where my skill is.
I love that. Yeah.
My innate skill is being able to see people's potential and set them up for success. So that plus what happened in high school really said psychology was the thing. Plus, I'm pretty chatty, and it was a great way to monetize being chatty. Here we are.
So in high school, seeing a therapist, I mean, was it something at that time that you felt like was maybe not acceptable to share with peers?
Yeah, I think there's a lot of stigma then and now around seeking behavioral health care. And I think part of my platform is destigmatizing that.
Yep.
And I have forced my husband to join that platform. He hosts a men's group here in the Valley, and his assignment in every men's group is to talk about how often we do couples therapy.
Oh.
Because I think the only way that you can destigmatize is to share your experience.
Yeah, absolutely. I engage in couples therapy. It's been really helpful, healthy for my wife and I. And, I think we were both at arm's length with it for a long time. But once you get there and you begin to open up, and I think all forms of therapy are just therapy. Like, it really does help you feel better. And honestly, it's been one of those things I'm glad that we began. That's really great, I think, too, from the men's perspective.
Mm-hmm.
It's not as, I feel like, there's a lot of machismo, and you don't want to necessarily admit that maybe your relationship needs some help, or you, as part of the relationship, would be a cause for that need. And so it's great that he's helping destigmatize it in the friend group, because that's really where it will, I think, escalate to being, accepted.
Well, and I think the big shift is from therapy is when something is wrong or it's reactive to a problem in the marriage or depression. Mm-hmm. I'd love to see it move to a place where we're doing therapy to optimize our well-being, to be our best selves, to have our healthiest marriage, to have be our best parents that we can be, because that's what therapy is intended to do.
100%. I think that idea of being our best selves and doing things in preparation of an issue and like strengthening yourself before you get there and you need the help is a big part of why I'm trying to do this through the podcast. So it's wonderful to hear like that idea is from a clinical perspective.
You're on track.
Yeah, I've got something going here like that.
Absolutely.
That's really, really great. I something you said before really caught my attention too about getting rejected from med school. Okay. Yeah. So I see you as extremely successful. This valley is lucky that you're doing what you're doing here.
Thank you.
And getting rejected from anything can hurt, right?
Absolutely.
It can have a real effect on the way you look at everything after that and your ability to, or the desire to take a risk that would propel you to something. When that happened, was it a difficult thing to go through? Did it, hold you back from anything? And then how might it have been a blessing in disguise for where you are now?
Well, I think rejection is always difficult. And I happen to be a person that tries to be perfect in a lot of ways, despite my years of therapy to undo that. So I think it was a really humbling moment for me. I was used to being top of the class. I was used to being the best, and to have that taste of humility and then have to do that deep introspection. You know, when you're 6 and want to become a doctor, it just becomes your path without the thoughtfulness. So I think the blessing was that it forced me to evaluate myself and figure out where those strengths were.
Okay.
And it was absolutely a blessing. This career and this path has turned into something I never could have dreamed of, and I'm really grateful. And it was very different than I thought, but it ended me here, and how could I not be grateful?
I know this environment of the valley is absolutely mind-blowing to me. I grew up in the suburbs outside Washington, D.C., and to me, the beauty there was the culture and the people, and, not compared to Europe or anything, but the history of the place really was a draw, but there wasn't as much awe-inspiring natural beauty as there really is here. Yeah. And it's always just jaw-dropping to me to come out here and, exist in it even for a little time. So I can understand the appreciation of landing here for, life. So talk to me about how that happened. How did you get yourself to Vail Valley?
My family and friends still have no idea how I got here or why I did. I was raised most of my life in Florida, been in cities. The joke is I love TJ Maxx and Trader Joe's, of which we have none here.
Yep.
But my sister-in-law, Molly, who's in the front row. Hey, Molly.
Hi, Molly.
Molly and Ernest moved here in 2017, and we would come visit every couple of months. And I remember distinctly driving through the Avon roundabout and saying, oh, we could never live here. And clearly, never say never.
Yeah, never say never.
And a big change was COVID. My family was in downtown Chicago. I had an infant and a 2-year-old, and my husband was in finance. And COVID allowed people in finance to do different things. Professionally, I was at a wonderful nonprofit. I had great experiences, but I'd kind of hit a ceiling. And so we sat down as a family and thought about where we wanted to raise our children, where our values were, what we wanted. And weirdly enough, the valley made sense. Molly and Ernest are less than 2 minutes away from us. And the opportunity to participate in what Vail Health was doing, for me, was pretty life-changing. As a psychologist, I love building legacy programs. I love being a part of something that will long outlast what I'm doing here on Earth. And Vail Health Behavioral Health is a disruptor in the space. So it's a little bit like working at a startup, because the innovation and ideas and creativity and willingness to push back on the existing institutions of behavioral health. I was like, sure, let's move our 4-month-old and our 2-year-old to the middle of nowhere with no house and no real idea what we were doing.
Wow. Well, I mean, that in itself, like as a family, is a huge thing to pick up and set roots elsewhere. What was it like as parents explaining to your children, hey, we're making a huge move here. We're going to go from Chicago to the mountains.
For me, it was easy because throughout my childhood, I moved every 2 to 3 years. So the way that I look at moving is it's an opportunity to try something new or try on something new. And a 2-year-old, it's a little bit easier to say Auntie Molly and Uncle Ernie are down the street. So I had a little bit of that, but When I look at moving, it's adversity that's controlled for kids and adults. There's challenge, there's opportunity to build resilience, but it's somewhat protected because we still had our family, we still had our core values, and we were going to an adventure, which is how we talked about it with our son.
I love that. Making anything with your family an adventure is the right spin, because I think it all is, especially when you're trying to figure out how to raise the littles.
Absolutely.
Yeah, we've talked about that before, and I think it's a pleasure to see them develop and take on those adventures with you. Yeah, so I wanted to ask about your professional title as a PsyD. Okay, so I didn't know the difference until we met, and you were, introduced to me as a PsyD, and I was like, it's nice to meet you. And of course, I had no real idea in the moment about that.
Yeah.
Can you, because I think it would be educational for those who may not know, to understand what a PsyD is and how it differs from the occupation of maybe just a straight up psychologist or a psychiatrist in that. I think it's a place for people to learn.
It's a great question. And I think a lot of people, even in the medical field, don't really know. So often you'll hear people talk about going to see a therapist. Therapy can be done by master's level clinicians, psychologists, and psychiatrists. So it's a little bit of a misnomer, but when we talk about therapists, most often they're people who've gotten their master's degree in clinical social work or mental health counseling, and they really prioritize addressing treatment goals through therapy, individual, group, family.
Okay.
A psychologist is a little bit different. We go through 5 years of graduate school and then 1 to 2 years of residency. And while we do therapy, a huge part of how we're trained is as a scientist and a practitioner. So we focus a lot on assessment, diagnosis, neuropsychological evaluation, and we really approach things from kind of a hypothesis or from a scientific approach. Where you have psychiatry, psychiatrists go to medical school and then they complete a very long residency.
Yeah.
And they tend to approach behavioral health concerns from a medical model. They do a number of things. They can do therapy. They often do medication management to address symptoms.
Okay.
So it is very confusing, and psychologists kind of do a lot of everything in between.
Yeah, it sounds like it. And I'm curious, how did you decide your lane?
I didn't really have as much thoughtfulness around it as you would think. I kind of stumbled across it.
Yeah.
I knew I didn't really want to be a social worker. I tried psychiatry clearly, and I didn't get beyond the MCAT. And so when I looked at clinical psychology, the reason I picked it is because I knew I wanted to do a lot of things. I knew I wanted to be a therapist. I knew I wanted to teach. I knew I wanted to consult, and I knew that eventually I wanted to be in leadership, and clinical psychology kind of encompassed all those opportunities.
Yeah.
And in fact, it's kind of led me down being able to hit all those points.
I love that. That's really probably the most rewarding thing, is to know how you got here makes a lot of sense for what you wanted to be doing, and now you're in it doing it, especially with VHBH. I mean, it's really incredible. So I'm wondering, the career is demanding. Okay, so being a parent is demanding. You've got, for anyone with children and a career, it is not an easy balance, I think. How do you approach managing the two, knowing that, here's the crux of it for me too, for your position, is that you're engaging in a community that has mental health issues, and you know that your children are surrounded by that, and the work that you're going to do will affect the improvements that are going to happen. And how do you internalize your position in that, not only as a parent, but as a clinician?
There are so many great parts to that question.
It's a big question.
It's a huge question. I mean, I think the first part is that I don't always get it right.
Okay.
I think it's really hard to create that balance as a working parent, and regardless of if you're mom, dad, or both to your kids. I think about a New York Times article I read during COVID, and they made the metaphor of being a working parent as juggling. And that when you're a working parent, particularly a mom, the balls that you have are all different.
Yeah.
Some are made of glass, some are made of rubber, and you have to do all this high-level calculus to figure out which balls can be dropped. Because I think the biggest fallacy about being a working parent is that you can have it all. How many people in the room have been a working parent? Can you have it all? They're shaking their head no, if you can't see. The reality is they tell us if you work hard enough or you do enough, you can have it all. You can have the perfect marriage and the perfect kids and the perfect job and the perfect house. And that's just unrealistic.
Yeah.
Our world is not built for that.
There are not enough hours in the day for
No,
that. Yeah.
no,
Yeah.
there absolutely aren't. So I think being a working parent is knowing that you're going to drop some balls. My son had fairy tale day at school today. I saw other kids had really cute costumes and they brought in food and parents went to decorate before.
Yeah.
My kid wore a t-shirt that had a bear on it. You know, that was one of the balls that had to be dropped today, you know,
and that's okay.
And it's okay, right? And he's fine. He thought it was great, but you can't juggle all of those balls at once.
100%.
And you have to figure out what you can give and take. And that is a lot of practice.
I love that. And that also is, I think, the thing that helps to have a partner, you know, like you're talking about, where you guys know when you need that time for you guys to talk about whatever is challenging, you know, that will alleviate a lot of like, okay, like I might have dropped that ball that time, but we're picking these up and we're running with these. And it wasn't the glass ball that could break. It was, you know, it was the squishy rubber one. Everything's okay. That's an incredible perspective. I think it's really exemplary too of, you know, so I have a wife that I'm so fond of, and she has a very, very demanding career, going through a lot right now she's in the retail industry and with tariffs, and she's wearing a lot of hats, figuring a lot of stuff out and all that. And the challenges are heartfelt because, you know, when you take your career so seriously, it's a lot. To watch that stuff like be somewhat out of your control when you know the demand that you need to meet within your career, and then to have that balance that you have to strike at home. For her, you know, being understanding of my career with travel and everything that I have to do, it's really a partnership. And I guess what I'm getting at is like that is not an easy thing to maintain by any means. And the art of it is that communication and the understanding. And also, like, somebody once put it to me of like, you have to be able to tell your partner where your operating level is each day. Like maybe some days you're at 100 and you can handle whatever, but other days you're going to be at a 10 or 15 and you really need some support. So I think, you know, when you have a strong working woman in the mix, like that's a very like important thing for the partners to understand. And I guess what I'm saying is it's really wonderful. I feel like that I have a partner that is like that, and I can tell that you know, you are that partner to yours. And it's just, I think the world needs more stronger women in positions that help other people and are doing good, you know. I'm happy to be talking to one today is what I'm saying. So I guess one thing I'm wondering in keeping up with all that is how do you know, with all those pressures outside of the relationship and keeping that healthy, how do you keep yourself mentally healthy? Like, where's the space for Paige?
It's a great question. So I can tell you what I do and what I wish I did more.
Sure.
You know, I think being a mom and just being who I am naturally, it's hard for me to prioritize myself. Like when you're juggling those balls and things that get dropped, often it's the working mom self-care. And I work really hard on figuring out what my needs are and communicating them, because I never learned that as a young woman. I never learned how to articulate, this is what I need, and how to take up that space. So a lot of therapy has been helpful in that. A lot of couples therapy to help him facilitate pulling that out. And you know, when I'm really struggling, I have a sticky note that has an Audre Lorde quote on it, because I think there's this idea that self-care is selfish. And so Audre Lorde said something to the effect of, caring for myself is not self-indulgence. It's an act of political warfare and self-preservation. And so I try and remind myself that what I am doing is for the greater good, which kind of takes away a little bit of the self-care piece. But, you know, I'm meeting myself where I am.
That's meeting in the middle in a good way.
Exactly.
In the first season of What Could Be Bad, I talked with a gentleman named Matt Wallace, who's a music producer, and he said that to me. He said, self-care is not selfish. And I had never heard that before, and that has stuck with me and been one of the strongest lessons I've carried with me in my life, but also through the podcast. It has come up at different times, not like in every episode or anything, but I think it's so important for us all to recognize that we can't be out there doing the things we want to do if we're not okay inside. Yeah. And that's like a starting point for being effective in your life and in the world. So it's great to hear you say that. I mean, with engaging in people, this is another direction of questioning, is like taking care of yourself so you can help other people. I'm curious, and I know there's HIPAA regulations. I'm not asking about any like direct, experiences from the patient perspective, but, when you are helping people, does that weigh on you? Is that how do you internalize some of those, the stories of life, like the things that people are going through that they really need to have help in order to get through? How do you deal with those moments?
I went through a lot of training to help separate myself from their experience and maintain that objective piece, but I'm still a human, right? I still get hit by it. But I think what I try and focus on is that, number one, it's a privilege to walk next to someone in their darkest time and for them to share that. But number two, and I have heard some horrific things, but I have also seen the most beautiful resilience and strength. And I have goosebumps right now, just thinking of the patients that I've had a privilege to work with. And I think this community in particular has an incredible amount of resilience and strength. And so while there's a lot of trauma and pain, we also have so much beauty. And so, and I do get in those moments where it's like, I know too much about the dark parts.
Yes.
But I am able to look at all of the incredible strength that people have. And that's what I try and go back to.
I think that's wonderful and very appropriate. It could be too much to see it another way or any other way to have the fortune to be able to have an effect when someone needs you the most.
It's a true privilege and honor that someone invites you in. And sometimes your relationship with your therapist in some ways is more intimate than it is with your best friend, because you share things that you've never shared with anyone else. Yeah.
I mean, my therapist knows things that I'm supposed to share with my wife soon, I'm getting there, and so to your point, that's spot on.
Right.
So I was wondering about, so this community already, to me, has so many incredible things going on, so much support. It's not only Vail Health Behavioral Health, there's all these nonprofit organizations that are like on the ground and doing the work in different ways, right? But you guys are on the verge of a huge new thing. The Precourt facility is about to open, which is just like such a giant benefit to the community. Can you talk about working on how that would be set up? Because I imagine it's like it's coming and it's going to happen, but like the details of how it's designed and the care it's going to provide is as important as the implementation once it's here. Can you speak to some of the ways that you guys addressed the build out of what will be here?
Yeah. So for folks that don't know, the Precourt Healing Center is an inpatient psychiatric unit that will open in Edwards. It will be 28 beds, 14 adolescent and 14 adult. And it's for people who are experiencing a psychiatric crisis. So people who are suicidal, homicidal, or having a psychotic episode. It's short-term, 7-day stay. Right now, the closest hospital is Denver. On the other side, the closest hospital is Salt Lake City. The other hospital that we had has recently closed. So what this hospital is intended to do is to be a place of healing, down to the name, the Precourt Healing Center. Most psychiatric units feel like prison cells. They are not bright, they are not clean, because most people are held there against their will. They are placed on a psychiatric hold for their safety. But the Precourt Healing Center is different. Yeah. And when I say different, it is wildly different. When you walk in, there is subway tile and granite countertops and pendant lights, and there are beautiful murals. The purpose of this place is really to be the beginning of a healing journey. Each room has a beautiful view of the mountains. There's a farm to table full kitchen. It's one of the biggest kitchens in Eagle County. We have drum circles, we have art therapy, we have a therapy dog. There'll be 9 hours of programming, including therapeutic movies for teens. Down to the staffing, the training. It's been incredibly thoughtful. The lighting, there are chandeliers instead of that like a fluorescent hospital lighting. It is meant to feel more like a spa recovery. And one of the really cool things is that in 2019, we had nothing here for behavioral health. And since that time, we've built the whole spectrum of outpatient care, have crisis services, school-based services, and now we'll have an inpatient facility so that when our community is sick, they get to stay in our community. They get to be served by their fellow community members that live here, know what it's like, know the hardship and the beauty. And that is an experience for a patient that isn't just life-saving in the moment, it's truly life-changing.
I can only imagine how many positive angles of being in the moment of needing such care to be able to stay where you live rather than being sent hours away from your support network. And maybe you do need a break from them, but to be that far, and I can speak to, the isolation and loneliness when you're away from people you love, when you really need them. You want to feel that they're close. And that's not a helpful thing, I think, in pretty much all scenarios. So it's wonderful that you guys are going to have that here. And I love hearing about the art therapy and, if you ever need any music therapy, let me know.
You already signed up.
Okay, good. I would love to participate and help. That it really sounds amazing. So will your workload even be more intense soon? Yeah.
Already.
Yeah. So is there anything preparatively that you're doing to get ready for that?
I have 2 trips planned, so that's proactive.
Yeah.
I talk about it in all of my therapies, individual and couples. And I think for me, a huge thing is nourishing my own support networks. So spending time with my friends and my family. We just got a camper van. I mean, people are shocked by this. I've never hiked in my life before coming here, and now I have a camping van.
Yeah.
But one of the reasons why I love it, I still don't like dirt. I still don't love being. We're very similar.
Yeah.
But the thing I love is that most places we go, there's no Wi-Fi. So I necessarily have to unplug, and there's no distraction. There are no iPads for kids. There's no TV. It's quality family time. And for me, that is what is so restorative. And I feel like that is what's going to help me sustain through the next weeks, months, years of this evolution at work.
I love that. It's great to picture families having time without devices.
Yeah.
I think that's one of the scariest parts of raising a kid. My kid has figured out the password on my iPhone, and I've changed it, and I don't know how he's spotted me doing it or what, but it's like this innate addiction that is really a thing that must be addressed in a larger format. It's great to aim for experiences that will be family oriented and healthy and immersed in nature, because I think nature is the antithesis of the device suck.
Absolutely.
Yeah, that's really great. So we're almost there. I've got one more big question. It's about your career path and knowing that this is a big step and this will be, I'm sure, years of work here. And I'm wondering, are there overarching goals or North Stars for what you'd like to do with your career?
Oh, that's such a great question, because if you had asked me 5 years ago, I would have had a completely different answer. One of the things that I really strive to is creating access to everyone, regardless of gender, sexuality, race, socioeconomic status, life experience. And I think at Vail Health Behavioral Health, I think the selling point that got me to move here was this idea of treating everyone with white glove service. So I think for me, one of the things that I want to see in my time here at Vail Health is the continued evolution of services that meet the needs of all patients, not just the resource patients, but everyone. And my real goal is to leave behind programming that's not attached to my name, that's not attached to anything I've done, but lasts time. And the last thing I think about with my career is really personally what I want for my kids to see. I want my kids to see that I worked really hard. I want my kids to see that sometimes there was sacrifice and that mom was not perfect. But I want them at the end of the day to be proud of me and to walk away with kindness and hard work are the two things you need in life. And I firmly believe that.
Yeah, that is wonderful. And I totally feel the same way about how I'm going about raising my kid. I think it's really important, I think, to instill the idea that perfection is just not achievable and not even worth aiming at. You know, we're all human beings. We're going to have our moments, you know, and we need to be accepting and understanding of that. And if they can see that in their direct role models, their parents, hopefully that will expand out to their circle of friends and to the greater culture that we're all a part of. You know, I think I think our whole nation needs more of that in general, just like the idea of understanding and tolerance. It's a great message for anyone, anywhere.
And I will say, I get a lot of things wrong in parenting all the time.
Yeah.
I think the one thing my husband and I do really, really well is modeling how to apologize and take accountability.
Yeah.
Because I think that's one of the things that is missing. And when you model apologizing, it helps them know that they don't need to be perfect, that it's okay to misstep, that you're still loved and you're still supported, and that you have to take accountability. So I do a lot wrong, but I do think that's a strength.
Yeah, I do the same. I'm working on it all the time. Yeah, totally. Well, this has been so great to connect with you and have this exchange. Thank you. I always end my podcast the same way. I say, everyone, be good to yourselves and be good to others. Thank you, guys. Been a great audience.
That went by fast.
It did. I don't know how long that was, but that was we answered all the questions I had.
We got there.
You did great, but there are questions out there.
Oh, okay, so yeah.
So you're not done yet.
We're not done yet.
One of the most important things to address our behavioral health crisis across the age demographic, but particularly for middle schoolers and teens and high schoolers, is focusing on building community. You know, when we think about all of the behavioral health concerns, if you've heard me speak before, I always say that I think community is the salve, not the cure, but the salve for so much that ails us. The research is clear. You're more resilient when you have better relationships and more community. So it's about making sure that those middle schoolers and teens find community that fits them, whether it's a sports team or theater club or the kid down the street. Whatever we can do as the trusted adults in their lives to help support them is key. I have a lot of behavioral health programming. I have groups, intensive outpatient groups to offer, great psychiatrists, wonderful therapists, case managers. I'm also wearing my bracelet from Roundup River Ranch. So for those of you that don't know, Roundup River Ranch is our camp for kids with life-altering medical and behavioral health diagnoses. We now have a camp dedicated exclusively to behavioral health, which is a great way to build community, because there's only so much you can do inside the walls of the clinic. It rests on community and trusted adults to help those kids feel belonging and find connection.
And on my end, I love hearing that that's going on here. And for me, my goal is to, create a fundamental shift in the culture, of our country. It's really important to be able to talk about these things. I think that the stigma is what really needs to go away. That it's like, my friend Matt hurt his knee and, he hurt his knee and he needed help. So he went and got help and he's totally fine speaking with me about the treatment and all that. And it's different for physical health than it is for mental health. So my sort of North Star is to affect the way that is approached, and it's a lofty goal. I don't expect to reach it this year, but I'm going to keep working at it. And that's kind of the pledge I have to myself and to people, is to, do what I can to have an effect.
And that's what you're doing.
Yeah.
Talking about it to destigmatize. That's a huge step.
Yeah. Thank you.
When you talk about the elegance and the decorations and the chandeliers, of the Precourt Center.
Yeah.
I'm wondering about these patients who come in from a less luxurious environment. They may be homeless, they may be living in a trailer camp. And how much of the environment influences their response to treatment?
I think that's an excellent point. I think one of the concerns about psychiatric hospitals in general is that once someone comes in, they leave and they're lost. Part of our philosophy at the Precourt Healing Center is the crisis team member that puts you into the hospital on the hold may also be the person running the deep breathing mindfulness group later. Your therapist that you might have seen an outpatient can walk across the parking lot and see you while you're inpatient. The psychiatrist you saw on the unit can carry you as an outpatient as long as you need. So I think there is a piece of that continuity of care that beyond the decoration and the elegance, help people feel seen and taken care of, and like they won't just be discharged and left on their own. And I do think it's a really important piece to acknowledge that that facility is nicer than my home as well, right? It is absolutely beautiful, and a piece of it is to provide respite. One of the things that's really interesting about this facility, there's only one other one in the country. It has a system called OxyVision that's built into the ceiling that takes your vitals. So when you're in a psychiatric hospital, every 15 minutes, someone needs to come in, turn on the light or shine a light on you to do a safety check. That is not conducive to behavioral health. So this system helps facilitate feeling safe and comfortable so that someone can get a full night's rest.
That
and
is
the
so
idea,
non-invasive.
it's
That is
right.
so incredible.
So that they can sleep, they can get the privacy that they need. And so our hope is that the entire experience is one of feeling loved and cared for and carried throughout the journey, and that they happen to be surrounded by a really beautiful place at the time.
Are you hoping to do anything about addiction?
Oh, that is an excellent question. You know, in the Vail Valley, we have a really unique problem, particularly with alcohol. Outside of most rural communities, we have a really, really high alcohol use disorder. And when you think about it, we are a rural resort community. The party doesn't stop here from morning to night to winter to summer. So most of our patients, I'd say maybe 30% have a problem with alcohol. So all of our outpatient psychiatrists and therapists are trained to support people that have a substance use problem. Our hope in the future is that we can do more programming outside of outpatient. There's no sober living in this community. There's no residential programming that takes Medicaid. So I think your question is a very mature and on point one. I think that's the next step of where we need to go. Thank you.
Benj, do you want to touch on the topic writ large?
Yeah, you know, I think addiction is something that we all want to do more to help, you know, and the reasons I think people end up becoming addicted are unique to each circumstance, and it's a very difficult thing to get ahead of and to deal with, because it's somewhat like, I guess, homelessness, in that everyone's got a different story and a different, you know, way that they've gotten there and what fuels their addiction. So I think everyone wants to figure out how to help, but there's so many different ways that you have to be able to help, because there's all these unique circumstances. And from my perspective is trying to approach the cultural element of it, I'm encouraging mindfulness, and I'm encouraging to be preventative and to not let it get to the point where you're addicted to anything, but you're rather more in tune with things that keep you healthy. So my answer really is, I think it's hard to, you know, to fix it, but what you can do is be mindful and be aware and be, you know, there for the people around you. If you see someone going through it, making sure they know they're not alone, that this is a problem, that most addictions are things that are disease oriented, and it's not necessarily a choice, you know, that they want to be addicted either. So there's a really challenging circumstance in that, But yes, that's a very mature question. I wish I had a very direct way to do something about it. But I think the approach I'm taking with all of these, mental health conversations is to, just make it more okay to talk about it and to go seek help when it's more than you can handle on your own. That feeling of being overwhelmed to the point where you turn to drugs or alcohol or anything that is there to fill that space is what I'm trying to fill with positive things.
And it goes back to the community piece, right?
Yes.
When you have those relationships and support, and in the Valley, we have AA and we have Reconnected, which is based on relationship building and support. And I think that's a first step. But to your point, it's so multifaceted. It needs a lot of pieces of intervention.
100%.
We're hoping our average length of stay will be 7 days. In the state of Colorado, when someone gets put on a psychiatric hold, it's 72 hours. So if you think about 72 hours being woken up every 15 minutes, that's absolutely not healing. Our hope is that over a 5 to 7 day period, they're able to go through our curriculum of mindfulness, of dialectic behavioral therapy, build connections with treatment providers they'll see on discharge. But that magic number is dictated by insurance and not by us. I wish that the clinicians had more power, but it is a problem with insurance. And getting those 5 to 7 days will frankly be a big fight because they want to discharge immediately because the cost of inpatient is so much higher than outpatient. So that's your first question. Your second question about what people are wearing, I'm actually going to take it a step further. There's been new legislation change that now allows patients, it's based on parity between behavioral health and medical, and now allows patients to wear their own clothes if it's not deemed a safety risk, which is very different than how it used to be. It used to be that patients would have to wear paper-like scrubs, and that is absolutely not therapeutic. We will also have clothing that are not scrubs for our patients to wear. Providers on the floor can wear scrubs if they want, or they don't have to. We just have to be thoughtful about what we're wearing in terms of safety hazards. But the idea is that people can show up as their authentic self in the space as long as it's safe.
To go back to the first question, I'd like to address how you answered it and the challenge of having insurance be a part of the process. When I was young, I was a pharmacist technician at a CVS where I grew up, and I was 16 years old as an intermediary between people who needed medication and it had run out and someone at an insurance company on the other line. And I learned the hard way about how heartbreaking those scenarios can be. So one of my goals with the work I'm doing now is the way I put it before is having a North Star, is to not only culturally break down the conversation so it's not stigmatized, but to affect legislation so that the treatment of mental health illnesses is more in line with the way we do treat physical health challenges and issues. So I'm hopeful that in time, facilities like this are roadmaps for the world, for our country, that we can point out and say, look how it helps to do it this way.
Colorado has a really large survey of middle and high schoolers. It's called the Colorado Healthy Kids Survey. And the most recent data is from 2023. And what's great about this dashboard is you can look at different communities. So I looked at ours in Summit County. The research is pretty remarkable. You're right. Statistically, we have higher risk here. 44% of those kids surveyed said that they felt their stress was overwhelming. 24% in the last 2 weeks said that they felt sad or hopeless, and 12% seriously considered suicide. I have goosebumps again. It is a remarkable data set that drives home the point that this is a real and immediate issue for our community. And when we think about the reasons why, our community is rural. It doesn't necessarily feel rural because we have all of this influx of culture and travel, and we have great thinkers here, and it doesn't feel like an isolated rural community. but we are. There's a huge amount of isolation across all demographics in this community. And before 2018, we really didn't have accessible behavioral health services. So when you add that rural isolation plus a lack of behavioral health services over time, it creates a huge amount of risk factors. So that, plus don't forget about COVID. We were speaking about it earlier tonight. COVID has had a huge impact on the development neurologically and socially of kids. So it's unsurprising, I think, if you take that 30,000 foot view, that our middle and high schoolers have a huge risk.
And to address social media as a specific problem, it's something that I'll be talking about on Sunday, is that, social media is designed to be addictive. Okay, there's no question about that. With that, what we have is an algorithm of something that's, as smart as any human could be, if not more so, that's reading into your attention and your interest, and it's feeding into that. Okay, it's a lot easier to disassociate from your environment when you're getting reinforcement and the dopamine hit of something that really interests you and is exciting, within this little device, compared to the challenge of maybe climbing a mountain and the release you get when you get to the top. And I think that's a cultural problem, and it needs to be addressed. And I think, part of what I'll be talking about is, like tools you can put in your mental health toolkit to address that. But it's like, there's things you can regulate, right? Like my talk's called Mental Resilience is the New Seatbelt, and the government regulated the seatbelts, right? But this problem is not something that I think can be regulated by an outside source. It needs to come from a personal desire to be healthy. It has to be a choice. And if that's not something people recognize as important for themselves, it's an uphill battle. And so it's the challenge of our lifetime. It's really something that, to use a mountain analogy, it's snowballing. There's this avalanche coming, and it's not just going to affect those that are here, but all the generations after. So we need to be mindful of that problem, and we need to be active in addressing it. And on a cultural level, I think, that's what I'm aiming to do and provide. Ironically, I'm filming with iPhones, and, this is going to be on the internet, but at least there's like some, positivity to it. It's a purpose. But yeah, it's a huge problem. And, you can see it anywhere you look, any person, even, adults are using phones more than we should. I get yelled at sometimes by my wife because she doesn't want me on my phone sometimes in front of the kid, and I don't want to be on it, but it's an addictive thing, and there's the intermittent response you get, that reinforces why you want to look at it. Sometimes you get great news, sometimes you get bad news. It brings you back to it. It's a filter for your world. So yeah, it's a massive, massive thing to deal with.
We have time for a few more.
I was just wondering, regarding this new facility being built, how are the family members of these patients educated on what is occurring in the facility throughout that 7-day period?
It feels like I planted you in the audience, because that's a perfect question. Oftentimes, parents and family members aren't included because it's such a short stay. And if you think about our community having to go to Denver, it's really difficult for working parents to make it to Denver for anything other than picking up their child. The way that this facility is run is it's going to be based largely on individual therapy and family and couples therapy while people are on the unit. We have 2 rooms on each floor that are built out specifically for family therapy, because one of the problems is that 4 days, it's isolated. but people go back to their system. And if we haven't changed the system or educated the system, those problems will continue to exist. So a huge part of the psychoeducation for family members is understanding what the psychiatric condition looks like, what the symptoms are, and including the family members in safety planning. Safety planning at discharge and throughout ongoing treatment. How can you as a spouse step over if you see your husband triggered? How can you step in as a parent in a way that your kid wants when they're feeling overwhelmed? And that's the really important component that I think your question really got at. It's missing in a lot of other facilities, but is really carefully woven into the fabric of the Precourt Healing Center.
It's an honor to pass the mic for our next question to an expert in multi-generational trauma and behavioral health around the world, Dr. Judith Landau.
Thank you, James. I just first want to say thank you from the heart. It's a joy hearing both of you talk about the importance of finding resilience rather than looking for pathology. And the idea that you're here in my valley makes me extremely happy. Just talking about COVID and the results around the world are 30% increase since COVID in behavioral health issues, physical health issues, and addiction. And our valley has gone up to almost 60% increase. So this couldn't be more timely and more needed. And I'm also thrilled as a family therapist to hear you talk about the importance of having the family involved. Research is showing that the family involvement needs to be continued for a minimum of 6 months, and that we need to get the families healthy and not just the kid or the individual. So I'm hoping that you and I can talk some about that at some point in the future.
Absolutely.
And the Vail Symposium has done an amazing job of starting work on building community resilience that I'm hoping that Vail Health, behavioral health will continue.
Absolutely.
So thank you both. This was very heartwarming for me.
Thank
You're
you
welcome.
so much.
Thank you for all the work you've done.
Yes.
All right, we've got one more in the back here, Mr. Sadler.
Well, for both of you guys, I'm raising two young kids in this valley, and I think it's linking the questions to from social media. Obviously, the kids are pre-social media, but the internet can be mean. So you see the mean tweets, you see, and both of you guys are in the public face a lot. So, and speaking to resilience, like, how do we build resilience in our community? How do we build resilience in our children to be able to stand in the face of being disliked and trying new things? I am blown away that Benj is starting, this podcast after being a rocker, and the courage that takes. And, you're starting some breakthrough therapy that you're probably getting some kind of pushback from traditional therapy. So how do you guys feel about that?
I mean, I think it's absolutely essential to having a healthier nation. And a healthier nation, what is that? It's smaller individual communities that make up what that is. And in order to do that, I think you need leaders and you need people that will stand up and bring people together in ways that are healthy, that provide experiences and educational environments that support the right things that we want to talk about, not the wrong things that we don't want them experiencing too young or too often. I think as families, we need to limit the amount of social media, the screen time, all of that needs, like the kids need a buffer zone. They need someone to help them with that, because I'm just seeing it with my kid. He's worn out after a long day, comes in and he wants, it's not a phone yet, he's 6, but he like plops down on the couch and turns on the TV for himself, and Dad, where's my dried mango and crackers, and is dinner ready? But he just wants to watch TV. And there's no easy answer to how exactly to do it, but some of the things that I'm implementing at home are, you can watch cartoons for a little bit, but then we're going to watch nature. for a while, and then the TV's going to go off and we're going to play a family game before, we're going upstairs to do bedtime stuff. So it's finding ways to compromise and include the activities and the things that you want them to know more about. Because I think, I was a very anti-authority kid. I'm probably still an anti-authority adult, but to some degree. And I think what is important is like not making it feel forced, right? You want to make these things accessible in an enjoyable way for the next generation, and to be able to show them your love for something, and to leave out the other stuff. And this is a point I gotta call my wife after this and tell her, you're right, I should be off my phone in front of the kid a lot more often, or whatever that is. It's hard, it's all hard. And it's like we get used to doing things, and not all of those things are healthy, and that's what we really need to make an effort to shift. So I think it really comes down to, the communities, as Paige is saying, is very important, and having that reinforced by the right leaders, and then that environment that they find themselves is like building confidence in them that they can make their own choices the right way, and that resilience will hopefully be fostered in the environments we can't control when we send them off to school, or they go to a friend's house and you don't know what they're doing for those hours. And that's where there's a lot of just like a veiled reality that we can't control. So it's more about what we do, as much as we can to set them up for success in that way.
And I think you hit the nail on the head. No matter what we try and do and protect our kids from, there are things as parents that are outside of our control. And for my kids, who are a little bit younger than yours, one of the things that we're really working on is naming emotions, not just anger, but the complexity behind anger. And one of the reasons for that is for them to communicate their needs, but also to understand the nuance of when someone's being mean to them. And so that fits in kind of with the idea of kindness. We really focus on, okay, your best friend is hitting you. We need to be kind because he might be struggling. The little girl at school hasn't bathed. We need to be kind because maybe her parents are struggling. And I think if we're able to teach our kids to look at that meanness with empathy and understanding, that it takes some of the burn away. There will always be burn when someone is mean or cruel or says something that hits you in your gut. But if we're able to flip it to empathy, and maybe they're struggling, at least to open that door of the curiosity, maybe they're going through a tough time, it takes away a little bit of that power that the meanness has. But it's so hard as a parent. You want to protect and you want to remove all of that.
Yeah, I think
but you can't.
Kindness and empathy, it's a great direction to focus on teaching.
Mm-hmm.
And with that, I'll invite all of us to embrace gratitude. Will you please thank Dr. Paige Baker-Braxton and Benj Gershman.